appeal. Just imagine you on 88.5 Sufra FM, talking, questioning, sharing your experience, information, education, entertainment, news, instructions, advice on diabetes, high blood pressure, strokes, menopause, AIDS, pregnancy, sex.
Sex? Did you say sex?
As prescribed, take your medication, exercise, and diet. On 88.5 Sufra FM, tell a friend, call your neighbor. Casualty 911 is on.
Yo, Toronto. No, dog, that's what you deal with it. We are talking about get up bad.
Not seen it?
Show it to me. No. It should be fine now. Put the foot on the back. So put number 3 on the back.
Number 3?
Yeah.
Which one is number 3? That one?
Yeah.
And
This
press,
one as well.
and press the button?
Yeah. Okay, I'll message you if it's on. It's good now.
So, morning everybody. We've been having some technical difficulties, and here I was busy talking, and apparently, thank you, Romanas, for picking this up. Am I on now? And audio is in chat. So, good morning to all our listeners. It's always a pleasure being here on Casualty 911. And those persons online, those persons online, those persons listening all around Soufrière, Canries, and Choiseul. As I was saying earlier on, You know, we're in the hurricane season, and this weekend we had a lot of rain, and we're asking persons to be prepared. Ensure that, you know, it's month end, persons get paid. So when you go to the supermarket, grab a few stuff and put it in a special container for hurricane supplies. You know, start picking up one by one. So one by one actually fills the basket. So when that time comes, if in the event that we get any hurricane or storm where you cannot go out, at least there is food supply for at least 3 days. Okay, so we're asking persons be mindful, start putting a family plan together, where start securing all your documents, like your land papers, insurance documents, and so on, making sure that you put these things in Ziploc bags and do what you're supposed to do. The message is out there. We're asking persons to be mindful because many times, sometimes we get elements of surprise when it comes to the hurricane season. And the other thing is we like to depend on, you know, other agencies to assist us at that time. And don't forget, these same agencies have their family, they have a responsibility, and so on. And please adhere to the warnings. The warnings are out there. A lot of people will know about it. Some persons might feel they don't want to comply. So we're asking everybody, please adhere to the warnings issued by the government of Saint Lucia and NEMO during this time, our hurricane season. So this morning we have our guest speaker with us. She's no stranger to the radio program. And one of the things that we know many parents, when our children are entering the pre-K, you know, preschools, and so on. And one of the things we find that is very alarming within our health sector is, you know, many parents do not take time to learn about their child development and what their child is supposed to do at whatever age, and what, you know, what they can do to help. And another thing is, like, when the doctors recommend certain things, are they actually doing it? And some of our parents in denial when, you know, they ask, the health professional asks them to go for further testing, that you have to go for further testing and evaluation. So this morning we are here to guide parents and guide, you know, not only the parents, but also family members. Because it's one thing that you talk to parents, but once family members are in the know also, they can provide a level of support. And that is why we are here today, because we feel that parents, when you come in and the children are assessed and you are guided, many of you sometimes don't really understand, even if you don't ask questions. Sometimes a nurse or the doctor, the pediatrician might ask whether you understand. You say yes, 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 yes. And then at the end of it, you have not fully understood what is happening. So we're here today with our guest speaker. She'll introduce herself and speak about development screening. Yeah. So Nurse Eloise, you can introduce yourself. Well, I'm sure I was in Islam on time, but
that's fine. I don't think they know this Eloise anyways.
No, that's okay.
All right. So good day. I am Shirley-Ann Eloise, Public Health Nursing Supervisor. And of course, I'm here to discuss childhood development screening with you today. Of course, when you come to the health center, very early we ask you to bring your children to us. So that screening, it starts before 10 days. So you would have remembered going to clinic, your prenatal clinic, your antenatal clinic, and the nurse asking you to bring your baby in before 10 days, not at 10 days, not after 10 days, because we have special screenings to do on your baby. There are things that we have to assess. If you come after the 10 days, we cannot assess. So basically, the developmental screening is a guide to help us assess your baby's growth as it relates to a few parameters. So language development, social development, emotional, physical, your baby's cognitive abilities. So all of these we assess. And if you do not keep your assessment, your appointment, sorry, then we may miss out. And when we miss out, when I say we, I mean you, the parent, and the nurse who is responsible for assessing your baby. And it's better for us to know early on that your baby has an issue rather than waiting for everything to escalate and then we cannot do anything to help you.
And that's when the blaming game starts.
Yes, a lot of blaming games. We would understand that it would be difficult for you to hear that your child was unable to perform a task. So we are here to tell you that do not be discouraged if your child is unable to perform a task. It could just be that day that your child was unable to perform the task. So sometimes we ask you to come back to us depending on how we assess the child and what happened during that period. Or sometimes we refer right away. And sometimes the feedback is not positive, and we'll understand why. To hear that your child was unable to perform a task, you may need to be referred so that your child can be assessed by pediatricians and whatnot. It's not something that you want to hear. However, it is very, very, very important that you take the next step so that early detection would mean early intervention and the issue can be fixed. So you see how your baby reacts. We drop, they jump. So they send this forward because this is what they're supposed to do. You will see we're passing our finger under the legs. So we're assessing. There are a whole lot of things that we assess during that 10 days. And what is important is the baby's weight during that period. So if after the 10 days, we're able to assess it, but then it defeats the purpose.
Yeah, because I remember that's the time you take the weight and the head circumference.
Yes, so we assess your baby's head, baby's length, your baby's head circumference, your baby's weight. That is very, very, very important vitals for us.
Yeah, very much so, because if that child is not maintaining that particular weight, then there's a cause for concern. Yeah, especially mothers, breastfeeding mothers who have a little difficulty in breastfeeding at that time. Yes, so that's one of the things that I know they say exclusive breastfeeding, but at that time, you just give birth and you have to, the child have to latch, and sometimes the nipples are sore. My goodness, I remember back in those days. And and the child is hungry. Yeah, but then of course breastfeeding is the best. There is no denying it, but there are circumstances where some of us are unable to breastfeed. And at that time, you want the child to get all the necessary nutrients when it comes to breastfeeding, and maintain that healthy weight that the child is supposed to have.
Yes, I'm glad you brought in your experience, because if you stay at home and you're having all of these difficulties breastfeeding and your baby is losing weight, then issues will arise. But if you come to us, we can assist you. We can show you better ways to position your baby, how to put the nipple in properly so your baby can get all the nutrients that he or she needs. So it's important, again, to come to us so we can deal with issues before they present themselves.
Yeah, that is good news, because a lot of the parents, they don't see the need. They feel, they just come they don't understand why it is important to come to the first 10 days. Yeah, so I'm glad that you could explain that to them. So having said that, nurse, at what other point should they come for assessment again?
Okay, so we have our developmental screenings and we have our regular screenings. So our developmental screenings, they assess a lot more. They're more in depth. There are particular categories that we're looking for to assess. So our motor skills, our emotional, our social language, all of these skills that we're looking for. So 6 weeks, we all know 6 weeks, 8 weeks, 18 months, 3 years, and 5 years. However, when you bring your baby in for vaccines at 2 months, 4 months, 6 months, a year, we do a little screening for your baby. So it's not the big ones, but we still assess baby because there are developmental milestones that they must reach at this age. So the 2, 4, 6 in a year, we do a little assessment, but the bigger assessments, there are 6 weeks, 8 months, a year and a half, 3 years, and 5 years.
So explain to me, nurse, what do you actually look for during the 6 months assessment?
Okay, for the 6 months, we try to see if your baby can sit assisted. Okay, so that is one of the main things that we look out for. If your baby can still roll over front to back, if your baby can hold items, bring it midway, all of these things we assess for.
All right, and the next one you said was?
For which one? For the development screening or
For
the
the
regular?
development screening.
Oh, so 8 months.
8 months.
So for 8 months, we assess whether your baby can now sit on their own, if they can crawl, if they can clap, because right now we're trying to assess your baby's motor skills. And this is the time when you come in and you say, it's a concern, we have to refer. So all of the little things, if they can pick up small items, because we're preparing them to hold pencils, the pincer grip, is it established already? Can they clap? Are they hearing? Do they know that if you remove an object, it is still in the room? All of these we assess for. That is very, very important.
Oh.
Yes. We also assess whether or not they're babbling because, of course, we're assessing the language development.
During the 8 months period?
During the 8 month period. Don't be surprised. For example, 3 years, we expect them to be walking up the step 1 foot at a time. They're running up the steps. So they're very capable. They do the things. Again, with being very capable, we have to stimulate our babies too. Okay, so that is important for the development of the child. Are we just giving them the phone or the tablets for them to be on? Are we putting them to sit on us, read to them? Are we discussing whatever we see, the pictures, even if it's not written? Are we discussing the pictures with them? So what you teach your baby is how your baby is going to, what you feed your baby is what your baby is going to give out. Really.
Yeah, very much so, because even at the clinics, I'm seeing the parents just have the child on their lap with a phone in front of the child's eyes. And that's one of the things I keep on telling them, that is not the time for such. And, they watch you in that big eye as if, who are you to tell me what to do with my child? And they don't understand, because that's why one of the reasons I brought you here today. It's, they have not understood exactly what is happening to the child when you put a phone or a tablet in front of a 6-month-old baby. You seated there for almost an hour. Yeah, the child falls asleep, she gets up, she goes back straight to that device.
Yes.
And the effect it can have on the child. But we'll get to that in another session because I know what it is. So nurse, after the 8 months for the development screening, which other time do they screen again, and it's for what?
Okay, at 18 months. So of course, motor language at the 18 months. So we assess whether they are able to, again, the object permanence, if they can build a tower. So you build a tower, so of course the cognitive is being assessed. You build a tower without showing them, and then they will build the tower after. So most times the parent will say the child does not have blocks at home, so they won't be able to build the tower. When they build the tower, the parent is left open mouth because the child builds the tower, because the child recognizes that this was done. I'm supposed to put one on top of the other for them to grow just like what they saw or what they're seeing if we do not put it down. Um, of course, there are different things. So this is where they learn, they tell, not where they learn, but they're pointing. So this is how they communicate. So they may say a few words, mommy, cup, come, whatever. However, they use their finger to point to communicate a lot. So they find things, they bring it to you, they point at something that they want. And that is very important. So if the child isn't pointing at that age to communicate, that is an issue. So we ask them to show us the light. So a lot of them, they would turn towards the light and look up. So we have some of them who point at the light, but most of them, they would turn, they would look up, especially the shy ones. So this is what we assess for, whether they know things, how the language is developing. Yes.
And that is where parents come into play. And like you said, is what you do with your child at that time to stimulate your child. Because I can tell you, as certain parents, they don't have that me time with their children, so they tend not to spend time with their children to teach their children stuff. And they feel they need to leave it up to the preschool or, but it starts from home.
Yes, you must know your child. So when the preschool says your child behave in that manner, usually it's the opposite. They're loud and rowdy at home and they're very nice and quiet at school. So you must know your child. Okay? If you know your child, then you know your child's capabilities.
Okay. So let's go on to the 3 years. Is it 3 years? After
3 years.
After the 18 months?
Mm-hmm.
Yeah.
So at 3 years, they can hold their pencil, they can do lines, they can draw straight line, they can do circle, they can read. They're going to look at a picture book and they're going to tell you what they see there. So they basically read to you. They stack blocks different ways. So it's a lot at 3 years. They know their colors, although we don't assess them for it, but they know their colors and yes.
So at 3 years,
and they can talk.
Yes. At 3 years, you assess a child, and the child, you realize, I'm not saying all children are the same.
Oh no.
And I'm not saying all children will be at the same level.
No.
But if at 3 years you realize definitely, or would the nurse pick up something before the 3 years or during the 3 years assessment when it comes to like development?
Sometimes, yes. Sometimes the issues start happening after. So you have a child who was, well, within the limits, doing everything, the screening, and then you have a child who regresses. We don't know why the child has regressed. Maybe the child isn't being stimulated. Maybe the child is home. You're not communicating with that child. You have not made time for that child. So, yes, you could have been, the initial assessments would have been good. The screenings, they would have been good. And then as the child developed, they were not able to keep up because we have different factors.
And when you say regress, because
I'm sorry.
Yeah,
they go back. So instead of going forward, they go back.
They don't learn as they should.
Yes, they don't learn as they should.
So you find they get weaker in some aspects.
Yes. And we have some children, they may be very weak in an area, very strong in another area.
So is that the time where you actually refer the children to maybe the pediatrician or the agencies at the 3 years assessment?
Oh, we refer them at every single point as long as there is an issue. So you come within the 10 days, there's an issue, we will refer you. You come at 2 months, 4 months, 6 months, 8 months, whatever time you come in and we see the issue, we refer you right away. So we do not wait until, like I said, sometimes it could be that, okay, we have a child, we know the child, and today the child just did not perform anything. The child came, did not speak to the nurse, anything like that. We will ask you to come back. And what is important to note, when we give you the appointment, we give you the appointment very, very close to your child's third birthday. So the week after your child's third birthday, we will ask you to come in. And there's a reason why we do that. We want to, when we refer you to the different agencies like the Child Development and Guidance Center, CDGC, we want, because there is a time frame in which the assessment must be done. So at 3 years, the assessment has to be done between 3 and 3.5. So if you come in early, we assess you, then it'll give CDGC enough time to get to you before the 3.5 month period comes. 3.5 years. Okay, so within that 6 months, you would have been seen by CDGC, and they're the ones who call you. We make the appointment for you. However, the employee from CDGC is the one who will contact you. So you do not just go to CDGC, they will contact you.
Yeah. I've known persons who have been there where the children have been assessed and they have been getting good reviews.
Yes, and if needs be, so if they do not see any issue, because sometimes at the time the child just did not do the task. So when we refer you to CDGC, your child performs all the tasks at the guidance center, they will dismiss you and send you back to the community. If not, if they have recognized an issue, they will continue with you. So they have all of their experts there and they will guide you and they will assist your child to get better.
So nurse, let me just ask, I know persons, persons most probably have been recommended and, from the get-go. And some of them refuse and they keep on coming to the nurse, and as soon as they leave the nurse, the nurse office, they're already grumbling because they're not happy with what the nurse said to them. What advice would you give a parent like this? We all will not have healthy babies, smart children, and so on. And so what advice would you give a parent? By the time you hear what the nurse said and the nurse has referred the child, everything else comes to your mind as a parent.
Yes, so as I mentioned,
if you're a caring parent, that is.
Yes, as I mentioned earlier, you may not be happy at the time that the nurse said your child has not performed a task that he or she is supposed to at this point, so we need to refer to see what is going on. I would like to think that the nurse would have told you so in the most empathetic way, okay? Because it is something that is very hard to digest at that time. So I would encourage you to keep that appointment, because every time you go back to the nurse is going to ask you. The first thing we ask, if you were referred, have they called? Were you assessed? Do you have to go back? All of these we ask. The only thing to do is to encourage you and to tell you the implications of your action, really. Okay? You don't want your child to keep moving up and not achieving these significant milestones, because therefore your child's development, it will take your child into adulthood. Okay? All of these little skills, all of these little tasks that we're assessing and that your child is performing is just so that when your child gets to be an adult, your child is skilled and ready for the adult world.
Okay. So after the 3 years assessment, which other assessment do they have?
They have the 5-year assessment, which is the fun assessment.
That's a fun assessment?
Yes, because you have little people talking, and then they're able to communicate with you. They tell you the most,
alarming stuff.
Yes, they tell you the most alarming stuff. Sometimes I behave unprofessionally because they make me scream. They just have the most to say. To interact with these little ones at 5 years, oh my goodness, it's the absolute best. I don't want to be biased, but Duga, children who come from Duga, primary school, I had the most fun with them. But On a normal day, I am screaming, laughing, bawling during the 5-year assessment. So, of course, we assess the cognitive. Oh, this is where everything comes. So the cognitive, the language, the social, the mood, so everything you see, this is the big one, the final one for them.
When you say cognitive, what do you mean?
Their learning ability, how they're able to process things, their knowledge. Oh my, they have so much to say, they have so much to give. I absolutely love the 5-year-old screening.
Oh. So, and then after the 5-year screening, that's it.
No. We will never let our little people go. So we ask them to come in yearly just to find out how they're doing. Are they socializing okay? Are they eating okay? Just little things, just to see how they're doing really. Okay, so that continues until they're about 12, until we have our adolescent health clinic back and they're absorbed into the clinic.
Okay. So parents, you hear that? After the 5-year assessment, you're supposed to bring the child in. I can remember bringing my daughter in after that, but then you're supposed to bring the child in for the assessment off and on.
Most times the parents feel like, okay, this is it. You've gotten your vaccines. You did the main screening. That's it for you. So we really get persons who come back.
Yeah, I was wondering. I am just the one that is not. I will come back after the 5 years, but now that you're saying it, I think it would have been important to come back after the 5 years to get the children accustomed to the system and so on. And another thing that I want to speak about is when the children go through all these assessments, we have additional services at our wellness centers and Suffolk Hospital as it relates to the pediatricians we have.
Yes. So of course we would refer. You can see the pediatrician. So your child has an issue. You may have discovered the issue before the nurse. You can just speak to the nurse who could just make a referral for you to see the pediatrician who is going to help. Another thing that happens too during the screening period, the nurse may, if your child is not turning from back to front, from side to side, the nurse may tell you, you know what to do. Put the colorful toys on this side. Let your baby reach for it. So your baby is going to turn eventually because this is what we want. So it's not only a matter of doing the screening. Sometimes we offer support. Not sometimes, we always offer support.
It's not sometimes, you always offer support.
Yes.
So I have a question. If I, for one, I'm coming to clinic at one of the wellness centers in the region, and for some reason I'm not happy with what the nurse is saying to me or guiding me. What advice would you give to a parent like that? Because I know most times they just go to another health center, maybe in the same region or in a different region. What advice would you give a parent like this?
Okay, anything to allay your anxiety, your fears. If you feel like you need to go to another facility, that is fine because the nurse would have read what the other nurse documented and what is on the book as well. Yes, she may screen your baby again if there are changes from God, but most times it remains the same. The nurse would refer you again to the CDGC, the Center for Development and Guidance Center. Yes. Okay, so going to another facility, most times it does not help. The next step is for you to go to the professionals who's going to.
The professionals.
I am very sorry. The experts, the more advanced individuals.
Yes.
So we screen you. We do not diagnose you. So they will diagnose you. They will not just diagnose you just
the
so.
Child, yes.
The child that is. They will do a series of tests, which includes blood tests as well, for them to make their diagnosis. Okay, so further assessment, that means more interventions. And this is what we want, more interventions so your child becomes better. A lot of the times you refer a child to CGGC and they come back with the skills. If not, they would make the proper referral. So your child may need to go to the special school. Then, special ed. Then that is what that has to be done to ensure that your child picks up, your child learns and is operating at their capacity.
And another thing is, one of the things in our region, parents tend to feel that going all the way to Castries is too much for them to go. And I keep on saying, when there is an activity up north, you can go, you take a time out for yourself if you want to go shopping up north. A few hours, it would not hurt to travel with the child for the assessment. Sometimes we as parents need to go the extra mile for our children. And don't look for excuses why you cannot go. Yeah, and why you don't need, because I'm saying, I remember speaking to a teacher just recently, and she's saying they say all the way to Castries, why isn't there a facility down south? And I'm saying people don't have money. I said, listen, if I know my child has a problem and she has an appointment in the next month, if every week I know transportation fee is $20, if every week I put $5, at the end of the day, I'm sure I will have enough money to take my child for the assessment. And I know the child will be hungry. I wake up early and I cook and I carry my lunch and water and juice. Bottom line.
You are very right. It's about prioritizing.
Priority.
Yes. So it is very important. And we say right Castries, right Viewford, right there. It's not all right. Saint Lucia is small.
Very small.
Saint Lucia is very small. If you've traveled, you have to take 5 buses, 6 trains for you to get to the guidance center, which you may have to pay a hefty price. There is a small cost attached to going to CGGC. That is the guidance center. They will not turn you away if you do not have the money.
Yeah, that's true.
They will not.
If you give them what you have.
Yes. It's a very small fee compared to the service that you will be receiving.
Yeah. And I agree with that because they are professionals.
Yes. Experts in their field. Language therapists, occupational therapists, all kind of therapies.
Yeah. And the other thing is, in that center, once you've taken your child, once it's recommended that you take your child there, they will work with you.
Oh, yes.
It might not be, it might be a little bit burdensome to you as a parent coming all the way from down south, but eventually you get used to it and you will definitely see the improvement. And it's one thing you take your child up there, but it's another thing that what the directive they have given you or what you're supposed to do as a parent when you get home, you need to do it too. Also, even at the wellness center, when the nurse recommend that you do certain things with your child, you need to take time to do it with your child because at the end of the day, that is what that will help the child a little bit more.
Definitely.
And that is one of the reasons, I brought Nurse here to speak about the assessment and how important is the assessment. So, Nurse, based on your experience and your ability.
Give me the book.
Oh, you want the book?
Mm-hmm.
I took my based on your assessment and your ability as a nurse, what advice would you give parents during the assessment? One, when they come in for the assessment, some parents are very impatient, but nurses need to give each child the time and proper assessment. So we're asking parents to at least bear a little patience. What else would you say to the parents that are waiting out there whilst the nurses are doing assessment for other children?
I don't think I need to add to that, but I will add to it. Sometimes you have to coax a child and it takes a while to just coax that child and encourage that child. And we know we have parents, other parents who are waiting, they need to go to get to work, whatever. But there are days where you'll have a nice smooth clinic where everything just goes well. And there are days where every other child you have to coax, you have to plead with. They're a little emotional today, they don't want to do the things, they're just not in their mood. So persons waiting on the outside, just practice a little more patience because it could be your child who's the one after when you come in, your child is the one who may need the encouragement. Okay, so we always asking the patients to just be more patient with us because we're really, really trying. We want to know that we are doing our best, that we really went above and beyond. Our last resort was to tell you to come back or to refer you. Okay, what could improve on the time that you spend with us is if you go through this. How do you know?
It's on me. So, yeah.
So if you go through your child passport, health passport, okay? So this is a very, very beautiful guide. So it has the screening. So what to expect. So it has a developmental surveillance tool and it tells you what to expect at each point under each category. Your gross motor, the visual motor, problem solving, language, social adaptive skills, all of that is in there. And if you're really somebody who's like me, who's a bit fussy and wants to know that my child is doing everything that she's supposed to at her age, you're going to go through it. And we encourage you to go through it so that you know your child is doing what he or she is supposed to at her age. This is a beautiful guide.
Oh, wonderful. Well, some of us at the time, we were not lucky
Oh,
to
yes,
have that.
yes. Some of you may have gotten the flat booklet, but this, oh my goodness, they went above and beyond. Everything you need to know is in there.
Yeah, even
When
nutrition guide too.
Nutrition guide. When you're supposed to take your baby to the dentist, you can start taking your baby to the dentist when your baby has 2 teeth. Huh? Everything, every single thing you need to know, it is in there. Beautiful, simple, very, very. Whoever put this together, kudos, because
thorough.
yes, they are very thorough.
Yeah, because bring your child to dentist when they have 2 teeth. And these pediatric dentists, I mean, they cost an arm and a leg.
Oh, I
mean, some of us go all out as parents.
Miss Wilson wanted to go all out to pediatric dentists, but we have the dentist at Sufre Hospital. Yes, she wanted to go to pediatric dentist.
Yes.
You can go to Sufre, make your appointment. Yes.
Yeah, and we have some very good news.
Oh yes, very, very,
nice.
very. I am terrified of dentists.
And
The Dr. Charles.
Yeah.
But I will go to Sufre Hospital to do whatever. Dental health is very expensive. But it's very inexpensive and it's free. The most you can pay is like $5.
Mm-hmm.
So
$5 to $20. That does have to pay a little bit more.
I'm speaking about children.
So yes, and that is one of the things that we encourage parents to do. Now that it's summer, make a cleaning appointment for the children. Not only cleaning, but for them to assess the children's mouth and to see what is happening with their teeth, what they need to do. And they're all up for that because they have been at the school, they have been at the infant school, they were at the infant school assessing and so on and trying to teach their children how to brush their teeth properly and so on. And one of the things that they find, a lot of the children have cavities. So parents, you need to be mindful of all what you give the children to eat and drink. And when it comes to oral hygiene, you need to play your part so that the children can get accustomed to doing the right thing, the flossing, the brushing properly, and the time to brush and so on. So I'm so glad Nurse said that. And having said that, is to get your children accustomed to the dentist, so they will not have that fear. Because we as adults have that fear when it comes to the dentist. We don't really like it because some of us, we were not raised going to the dentist at a very young age. So now is the ideal opportunity to start getting your children accustomed to the dentist. Although some of them might not sit on the chair for more than 5 minutes. But it's a good start. Well, some stays more.
They stay so well. I had my reservation. Mm-hmm. The dentist told me she prefers to work with children because they stay.
Really?
Yes.
So it's me that giving the dentist all that problem.
Yes, took my daughter shocked. Yes.
Wow.
remember, they don't have that fear yet.
They don't have it.
Yes, so they're going to stay, and it's not a painful procedure or anything like that. So
Yeah.
they will stay, and this is where they get accustomed. So they look forward to it. So the earlier you introduce them, the better.
Yeah, because my daughter, she goes to the dentist and she doesn't really have a problem because I already tell her she needs to go and clean. She does a clean twice a year, and to
Yes.
her it's nothing. It's like routine for her because
Mhm.
she had been going to the dentist at a very, very early age, which cost me an arm and a leg. I know.
Because say
But-
so carefully.
But then
Mhm.
there's an upside to it, and it helps them protect their teeth quite a
Mhm.
bit.
And good teeth is good heart.
Yes. So when you smile, they actually see nice teeth, and that's what the children really like. And boys and girls. Sometimes we focus on our girls and we forget about the boys.
Oh yes.
Boys and girls. They will be in the house for 6 weeks, I think. Bring the boys to the dentist. Bring them and get them to start coming to the dentist all the time, especially our boys and our young men and even our adult men smokers also. So I'm really happy that you brought that up. Now, another thing I really want to talk about, it's already 11 o'clock, but then another thing I want to talk about is like, sometimes parents are unable to come themselves and then they send somebody else for the assessment. Maybe that person is not able to explain to the parent like they should, or they don't have that ability, or they don't even understand what the nurse said. Because what advice would you give a parent like that if they have not understood whoever they sent for them on behalf of them, because they could not come and they did not understand what message that the nurse sent out for them? What advice would you give a parent?
Okay, so sometimes we have our nurses reaching out to these parents. So the parents weren't able to come if they have recognized that in the assessment that whomever that you sent was unable to comprehend what was discussed. They will call a parent. A lot of the times too, we have the parents calling to find out, or they come in themselves when they get a chance to. So that has helped a lot. We strive to create a really good relationship with the people that we serve. So this is a good example of what we do. We communicate after. So our communication does not end when you leave that door. Okay?
And another thing is, I know parents have their own perspective, their own beliefs as it relates to, when it comes to healthcare and so on. And some parents might not, bring the children in our healthcare systems, either for assessment, vaccines, or anything of that sort. What advice would you have for these parents, just for the development, the assessment aspect? What advice would you give these parents?
Okay, so very early, we stress on the importance of the assessments, especially the big ones. We really stress on the importance and why you're supposed to come in. There's not a lot that we can do, especially being short staffed. We cannot come to your home like we would have in the past. When we can, we do. However, we're unable to, and we try to follow up as much as possible and to just inform you of the importance of the screenings and what you're going to miss out on and the implications in the future.
Yeah. Thank you so very much, nurse. It's now 11 o'clock. Just any message out there to any of our to our listeners?
Okay, so if you did a pap smear recently, so as recent, well, August last year is not recent, and you have not received your result, please come into whichever facility that you would have done the pap smear, please go in to collect your results. We have a whole lot of results that are piling up and persons are not coming to collect. We do call, you do say yes, and you do not come in, but we need to give you your results. It does not take very long for us to get your results back. We get your results in less than 3 weeks. So if you be a dear and come in to collect, we'd really appreciate that. We have new services coming, free mammogram. We'll let you know about that. Yes.
Yeah, free mammogram is definitely coming on stream for our ladies, and I can tell you, now with modern technology, so you know, it's a good thing. It's a very, very good thing. I have done mine last year. This year? Last year?
Last year, October,
Last
they
year,
had
yeah.
the free things, but this time it's going to be for everybody,
No,
not just.
I did mine at Tapion.
Oh, okay.
But last year, October, we had free mammogram for women under special conditions. But this year, we're going to have free mammogram for, I'm not sure what criteria, but
Over age 40.
over the age of 40. And so that is ideal for our ladies out there. And also we have the men's health clinic every
Yes.
first and third Wednesday of every month at Super Hospital at
La Femme.
Lafag Wellness Center every second
Second.
Saturday of every month. And also we're issuing free prostate examination
Oh, yes.
and the blood and the PSA
Yes, and ultrasounds if needs be for the men.
and ultrasound if needs be for the men. So we have
For
quite
free.
for free. That is all what we're saying there to you is free of charge. Also, we have the PBF, the performance-based finance, which we have spoken about on the program, where they offer many various blood tests, liver function, kidney function, cholesterol, urine analysis,
HbA1c.
HbA1c, and all of these tests that gives you a comprehensive a comprehensive test that helps you know what your status when it comes to so many things, so many different parameters when it comes to healthcare. So we're asking you to come into our wellness centers within the region. It could be Marouge, Delse, Lafargue, Fongejac, Soufrière Hospital. We have them
And
on different
Eton's.
days, and Eton's also. So we have it on different days. So you can come in and do your test. It's free of charge. If you've already done it, then you qualify after 1 year to do it again. Yeah, nurse?
Mhm.
But then, so that's one of the things we're asking you. And the men, if they're offering the prostate test free of charge, all you need to do is get the voucher, and then you get to do your test at which lab?
Right there at Soufrière.
At Soufrière Hospital,
And
they do the
Lafargue.
blood and Lafargue. So there is no reason why you shouldn't come in and do the prostate. And we know that's one of the issues that is that's plaguing our men in our society as it relates to enlarged prostate as well as prostate cancer. So come in to find out your status. There is nothing to worry about. Also for the ladies, I remember a friend of mine was saying, the new technique for the pap smear, they're picking up the HPV, and a lot of women have a lot of concerns. But even if you have concerns, you already do the test, come for the results. There are treatments that are available, and the gynecologist will explain everything to you in detail.
Mm-hmm.
They do the treatment, they guide you where you can get the treatment if we don't have the treatment available. And it's not even as expensive as you might think for the treatment, and so on. So, and some persons will just be monitoring you and guiding you. So these are the things you can do, because early detection is key.
Oh, yes.
And preventative measures is also key. So if you do that, if you're already confident, what is keeping you from coming and take the results? So we're asking the ladies, come in for your results and encourage other women to do the test. I'm sure based on your previous experiences and now when the test was done, it was not so uncomfortable as you would thought. I too, for you, have been very, very, very uncomfortable. But I guess with time, the nurses have developed their technique and they've gotten better over the years. And I can tell you, my first experience with the pap smear and this one, it's completely different. You understand? So I guess, and different persons have different hands.
Yes, your comfort is very important to us. Very, because we want you to come back.
Because they, like they said, they want you to come back. So they'll try as much as possible to make you comfortable. And don't worry, the nurses will, as soon as they finish, they forget what you look like already. A lot of women say, me? I'm not coming there for the nurse to see that. Please. You've seen so many of that, they can hardly remember what you look like. So again, come in and do the pap smear. We're urging our women to come in as well as our men. We now seeing a little increase in the numbers for the men as it relates to the men's health, but the older men, we're not seeing the younger men, and that's what we're asking for. The younger men in their 30s, in their 20s, come in, yeah? And that is a start for you. When you start coming, the doctor can guide you and so on, all right? Having said that, we would like to say thank you to all our listeners. Thank you to Super FM, especially Rome, in helping us set up this morning. I'm really grateful. And again, our listeners at Hotel Chocolat, OGs, and everybody around, thank you so very much. And I must say thank you to all our listeners who gave feedback. A gentleman met me and he said we should speak a little bit more Creole. So I'll keep that in mind, definitely. I do speak the Creole pretty well as my colleague Fawn. So next time we will have to do that a little bit more. All right. Again, thank you so very much. So have a good day, everybody, and do take care.
Bye. You see you all on your tall chair.